Um, I'd like to introduce myself. I'm Isabella Rocchietta. I'm 100% Italian. I was born and raised in Milan, where I went to dental school. Then I spent my postgraduate time in Boston as a research fellow at the Harvard Dental School, and it was amazing. When I came back, I kept on working at the University of Milan and in private practice in Milan, and then we moved to London just 3 years ago, which is a fabulous city. I practice privately in London, and all of my research is performed at the University of Gothenburg in Sweden, just to complicate things. All my private practice is limited to periodontics and implant dentistry, and with special focus, well, covering all the perio, implants, and especially bone grafts and bone regeneration. That's what I really, really like. Well, as explained during the lectures here, the most fascinating advances that we are currently having is translating everything that in the last 10 years we have performed through the preclinical studies, hence bone regeneration without the use of autogenous bone. So using the tissue engineering concepts and applying them to our patients. And this is now finally coming, and it is very, very exciting, because if we can get to the point where we can regrow bone just by using off-the-shelf products, or telling the patient that we're not going to use any extra bone from them, well, then that's a very, very good thing. Well, we know that the bone morphogen, the BMP2, is a very, very effective growth factor in the family of the growth factor to promote bone regeneration. However, it is extremely costly, and the intraoral use of it is probably in a routine daily clinical use, it is not justified. The growth factor that we've been working on is the recombinant human platelet-derived growth factor, and it has a series of interesting properties, one of which is the angiogenesis, which means that it obviously attracts and forms the neocapillaries and the budding of, which means basically the blood. This is then reflected obviously not only on the hard tissue, which is bone, but on the soft tissues as well. And we've seen clinically that the soft tissues heal really well when the growth factor is used. Well, considering that there are many out there, and the fact of using, for example, the PRP, which still people think it's a new technology, whereas it's obviously quite dated, it gives you a concentration, obviously, of plasma, which has nothing to do conceptually with the use of a growth factor like the platelet-derived growth factor. So it's a two different scenarios where obviously the concentration differs so much in the positive sense towards the PDGF rather than the concentrated plasma, that I do not find any indication or justification for all the centrifuged platelet-rich plasma. Well, I believe that there is no best bone graft, so let's start by saying that we obviously have to think of Mother Nature, of biology and histology. So there is not something that is better than the other. They react and they heal in slightly different ways. We have extensive information on xenografts, on deproteinized bovine bone minerals. Why? Because within the extraction sockets, or within underneath the membranes, or in GBR in general, they are long-lasting and they are slowly resorbable materials. And probably this is a good effect. Once it was considered negative, but now it's obviously considered a good effect because we want to keep the volume. So of course, and then we can enter the other different categories of grafts, which of course would require a lot of time in describing the pros and cons of each of them. Yes, of course, the 3D printing, again, is not something new. However, in the dental field, of course, it has changed our ways that we approach at the diagnostic level our patients. It is certainly a communication tool, but the most fascinating is that we can literally have the reconstruction of important, severe or difficult cases even before we actually treat the patients. And this is simply done in-house, in our case, through cone beam CT scans, where the patient, of course, has a traditional scan, and then we have the 3D printer working on this, or through digital pictures. So the evolution of these printers is such that you can literally have even a three-dimensional reconstruction of a face through just a simple picture. And this has an enormous spectrum of advantages and usage in every field. So it is quite an interesting and fascinating world to dig into, especially in our profession. Well, the EAO, which is obviously something that I really care for and I believe in. I was the chairman of the junior committee for many years, and of course I created, in a way, because we were the very first ones, we created this group, and it was a fabulous group of individuals. We were 7, each one of us from a different nationality, and we created very, very large summer camps with the idea of networking and sharing and throwing out completely crazy ideas within a group of unbiased clinicians and researchers all around the world. It was fabulous, and we've done many, many activities about that. Now I'm in the communication committee, and I am the editor, together with David Nisand from Paris, of Inspired, which is the EAO kind of alternative journal. And I'm really happy because it's the first time that we can actually put printed on paper and on the web page basically something new, unbiased, where everybody can literally say what the truth is, what they really think. So it's kind of a bit unique. And it's written with a spy, like 007. So it's like we are not only inspiring, hopefully, people, but we are spying into the reality. And it's really, really fun, because we can really, and we had amazing guests, we had interviews, guests who wanted to write their own opinion, and it has been it's very new. We only published 3 issues, we're now ready for number 4, but it's very new and interesting, the fact that finally we can say, if things go wrong, they go wrong. We're not biased. Basically, of course, there is a difference between more on the European side and the US side. And the difference is we've got, obviously, very good professionals everywhere. The Italians are very talented, skilled, and they use a lot of their fantasy and very skilled from a prosthodontic point of view and on a surgical point of view. The Americans obviously have amazing education and really high end. There is a difference, UK, Italy, as in Europe versus US, from a treatment plan point of view. I've seen that the Americans tend to be more proactive and intervene rapidly on patients on treatment plans, whereas the Europeans tend to slightly be watching a little bit more and obviously being slower in the treatment plan. Of course, if the problem is there, it's solved either way. So these are all generalizations, of course. Oh, plenty, like massive. Well, I obviously love traveling. Traveling is the #1 hobby I have, and that's why I'm happy to be in California. I love just, traveling in the most remote places, and I'm lucky enough that my husband is a passionate of photography, so we both go in that sense. Of course, I have 2 little children, so that's probably my greatest passion. 2 little boys, 2 beasts, and they're quite demanding. And in terms of passion, I love languages. I love learning different cultures, and I think that's really what summarizes everything. Oh yeah, I love sports. I mean, sports is part of my life, and I think it's you need it for your brain, much more than for your body. And I like real sports, as in I have a passion for off-piste skiing, basically free ride, and can't wait to try the US mountains, because obviously we've localized ourselves only in Europe. I love scuba diving and everything that is, sporty.